So for a full head-to-toe assessment, we're going to start at the head. You're going to just inspect first, see if there's any asymmetry. You want to palpate. You can check their lymph nodes, see if there's any swelling or inflammation. You want to use a pen light to check the oral mucosa, see if there's any dryness, discoloration. Have them lift their tongue up. You want to check their teeth as well if they do have teeth. Then you can move to the ears. See if there's any drainage or redness that might indicate infection. Then you want to ask the patient a couple of questions about to assess their level of consciousness. So you can ask them who they are, where they are, what time it is, make sure that they line up with reality. Then you want to check their pupillary responses. So you can use your pen light again, and you're going to go in from the side, and you're going to assess both eyes, make sure that they're both reactive to the light. They should constrict when the light's over them. So you want to make sure that they're both equal and reactive. Then you're going to move to the musculoskeletal system. We're going to check their grip strength. You want to use both hands at the same time so you can assess the symmetry between them. You can have them squeeze your hands as hard as they can. Then we'll move down to the feet. You want to have them, resist them pushing down on your hands, and then you're going to have them pull their feet against your hands as well. To check range of motion, we can go back up to the arms, and you can have them try and flex their arms up like they're doing bicep curls, and you're going to resist it a little bit. See if there's any imbalances or weakness, asymmetry. You can do that with the knees as well and the ankles. Next, we're going to want to check their peripheral pulses. So you want to check their radial pulses. Check them at the same time. Check the quality of them, if they're thready, if they're bounding. And you can move down to the lower peripheral pulses. So you can check the dorsalis pedis. You never want to use your thumbs because they do have a pulse of their own. So if they do have good blood flow down to the bottom of their body, then they should be pretty strong and present on both sides. Then you want to check the posterior tibial. Okay. Then we're going to move up to the cardiac system. So you want to check all the landmarks. Use your stethoscope to auscultate aortic, then to pulmonic, down to the third intercostal to Erb's point, and then tricuspid, and mitral. You want to listen to the apical pulse for a full 60 seconds. And then we can move to the respiratory system. You're going to end up assessing both landmarks, and anterior and posterior. So we'll start anterior, just above the clavicle. And we're going to move down in an S formation, like a snake. You don't want to auscultate over a gown or clothing, or else you might disrupt the natural sound. You might have disruption in the sound. But for the sake of the video, we're going to go over the gown. And some patients do require oxygen. They might have a nasal cannula in or a mask. Make sure that it's hooked up to the oxygen supply. We're going to have them sit up to check the posterior landmarks. In the same formation, you're going to start at the top. Make sure you don't go over any bony prominences, or else you might not hear anything at all. You're listening for any adventitious sounds. You don't want to hear any fluid or crackles. They should be clear in all lobes. Next, we're going to move down to the abdomen. So you're going to start with just inspecting it. You're not going to touch anything yet. You want to make sure that you see if there's any distension or discoloration, any bulging. Then you want to auscultate before you palpate because you don't want to disrupt the current state of bowel sounds. You're going to check each quadrant until you hear a sound, so a gurgling sound. If you don't hear anything, you're going to hold your stethoscope there for a full 5 minutes.
Explain the procedure like I did,
And now we can palpate. You want to feel for any masses, any distension, if there's any pain when you do it. Next, we can move to the genitourinary system. Some patients do have Foley's, so you want to make sure that the Foley bag is underneath them, below the pelvis, so that the urine doesn't back up. You want to make sure that the Foley is intact, that the skin around the Foley is also intact. Make sure there's no redness or chafing, any bleeding. And in the bag, you want to check the quality of the urine, see what color it is, how much there is, if there's any redness or clotting in there. Okay. Next, we're going to move to the skin. You're going to do an overall skin assessment. So you want to check to see if their skin is normal color for ethnicity. Go all the way down the body. You're going to also check, make sure you check the bony prominences, so the elbows, the sacrum, the heels, because those are very prone to developing pressure ulcers. And you can move to the IV. If they do have an IV in, you want to make sure that it's intact, that there's no redness or swelling. It could indicate infiltration. Make sure that the dressing over the IV is also intact as well. And that is a head-to-toe assessment.